For those questions we aren't able to answer during the hour, certain members of the panel will be available afterward to continue to engage as many of you as possible that didn't get your questions answered. So with that, I'm going to go ahead and introduce our panelists for everyone's introduction. So first, I want to introduce Jenna Hausman, Chief Executive Officer for Children's Hospital Colorado, Dr. David Brumbaugh, Chief Medical Officer, Children's Hospital Colorado, Pat Gibbons, Chief Nursing Officer, Children's Hospital Colorado, Dr. Mike destefano, Chief Medical Officer, Children's Hospital Colorado Springs, Summit County Commissioner Tamara Pogue, and Executive Director of the Colorado Rural School Alliance, Michelle Murphy. Thanks everyone for joining us today. I'm going to go ahead and hand it off to CEO Jenna Hausman.
Good morning, everyone. Thank you for your time this morning to spend with us, really understanding in more depth what's happening to Colorado's children. In our history, Children's Hospital Colorado has only served one mission, and that is to improve the health of all children. For over a century, we have extended the depth and breadth of our services and our expertise. It now touches all 50 states, and it touches countries around the world. The challenge, though, that we're facing today in Colorado within our home state is that our children are experiencing unprecedented levels of pediatric mental health. And so important to our history, to who we are as an organization, is partnering with parents, with communities, with leaders, and other organizations to solve problems to make the world a better place for the children. And right now, Colorado's children uniquely need our help. The partnerships we are seeking today really are about a call to action to help an entire generation of Colorado's children. In my role as CEO of Children's Hospital, but more importantly as a mom of 3 children who are growing up in this generation, it has been devastating to see suicide become the leading cause of death for Colorado's children. For over a decade, Children's Hospital has intentionally and thoughtfully been expanding our pediatric mental health prevention services, outpatient services, and inpatient services, but it is not enough. Now we are seeing our pediatric emergency departments and our inpatient units overrun with kids attempting suicide and suffering from other forms of major mental health illness. Today, you will hear what that crisis looks like for a few of our partners, but please know there are so many other organizations across our state who are equally overwhelmed. The sheer magnitude of this situation warrants a different level of support. It's required by state and federal government, which is why today, for the first time in our 117-year history, I'm declaring a pediatric mental health state of emergency. I know we are all weary of the current COVID public health crisis, but it does demonstrate how when we come together, we truly can overcome. My hope in declaring this pediatric mental health state of emergency is that the state of Colorado, our community partners, and all of us can come together with a different level of priority focus and a different level of resources to address this crisis. The frustrating truth is that our schools, our counties, and our healthcare providers across our state have really been taking extraordinary and in some cases even heroic action to create workarounds to a system in our state that simply cannot handle the volume nor the acuity of demand that we are facing. The current system is simply unsustainable and it's failing our children. Colorado is known for its innovation and collaboration. Our children need us to rally together, to embrace their mental well-being, and most importantly, save precious lives. I'd now like to introduce Dr. David Brumbaugh, our Chief Medical Officer.
Thank you, Jenna, and thanks to everybody for joining us in this conversation this morning. I've been in practice for over 20 years in pediatrics, and I'll tell you, I've never seen anything like the demand for mental health services that we've seen at Children's in the last 15 months, but most acutely in the last 3 to 4 months. So our inpatient behavioral health and mental health resources have been completely tapped throughout the pandemic. Those beds have all been full, and the supply has not met the demand. But in the last 3-4 months, something has changed even more dramatically. So our our acute behavioral health presentations across our children's hospital system have increased 90% in 2021 compared to 2019 year to date, kind of comparing it to a more normal reference year for us in our system. So that's almost a doubling of demand for acute behavioral health services. And there have been many weeks in 2021 where the number one reason for presenting to our emergency department is a suicide attempt, the number one most common reason for presentation, which is really extraordinary. And obviously, we've seen a lot of families coming through just completely distraught about their children. And I remember one conversation I had with the dad a couple of weeks ago on a weekend, helping to arrange transfer of his son from an outside hospital to Children's. It resonated with me because we had so much in common. So we both were proud fathers of ninth graders, and kind of talked about how our sons had struggled, this year because, they were starting their high school journeys without actually being in school and having normal interactions. And both of our kids were baseball players and were in the midst of kind of that part of the year. His son had tried out for the baseball team at his school and hadn't made the team that he wanted to be on. And it was that week that he tried to take his life. I'm a little choked up because our kids were so similar. He was so shaken. But that's what we're seeing, normal childhood adversity. Not making a ball team is something that probably happens 10,000 times a day for high schoolers across our country. But our kids have run out of resilience. Their tank is empty. And that's where we are right now as a system and as a state. And it's impacting families across our metro area, across our state. And I'm sorry, but this is what we're feeling as caregivers every day. So as a result of this, we're seeing kids who were largely functional, who the kind of floor has fallen out from them. They're attempting suicide. They're populating our emergency departments. And on any given morning across our system, we have a dozen or 2 dozen kids waiting for an inpatient behavioral bed that they may wait hours to days to have access to. And this has stressed our system from the EMS providers that go to the house all the way to our psychiatrists who care for these patients when they come in. And it's really a tough time. So I'll pass it over to my colleague, Pat Gibbons, our chief nursing officer, to talk a little bit about how this has stressed our system. Thanks, Pat.
Thank you, David. And thank you all for the opportunity to share our experiences with you all today and ask for your help. Children's Hospital is responding to this mental health crisis in several ways. We have increased our inpatient and outpatient behavioral health services for children, thanks to the support of our community philanthropists. As an example, here at Anschutz Medical Campus, we've increased our capacity by more than 50%, or will have by March of 2022, increasing our programs such as eating disorders, partial hospitalization, intensive services, our neuropsychiatric special care inpatient area, which is an area that I want to highlight is one of the very few in this country serving children with very severe autism and other mental health issues that need inpatient services. In addition to these beds in our Pediatric Mental Health Institute, we also have plans to convert some of our pediatric medical beds to med psych beds. As David said, we are tapped out in all areas. In our emergency departments throughout our system and our other inpatient areas, we are doing our best to provide a safe environment until we can find the appropriate placement for the needs of these children and their families. But it's not enough. We can't build enough beds to keep pace with the demand. We just can't. And so in the meantime, we are in a crisis mode regarding the behavioral health needs of children that we serve, in addition to focusing on and anticipating the normal seasonal illnesses that are common to children, and wondering what's going to happen with SARS-CoV-2 next generation and all the variants related to that, We're used to managing staffing and resources to do this work on a routine basis, but now we have this additional surge of children with mental health needs. Here are some examples of things we're doing. As we mentioned, the behavioral health units are full. So children with behavioral health care needs are being held in our medical, surgical, and emergency departments, awaiting placement, whether it's inpatient in another location or a community agency. Our usual staffing models are not adequate to provide a safe environment for these children, so we've had to upstaff our behavioral health counselors, our sitters, and other roles to meet this surge in demand. You can only imagine the stress on the families, these children, and our team members. Seeing children as young as 8 years of age, suicidal, not with just a story or plan, but they've actually acted on those plans. As well, adolescents. We've had several of our team members working diligently every day, every hour, looking for placement for these children. And the reality is there are limited resources in our community and in our state. So in addition to this, we've stood up a system-wide behavioral health placement team that works every day. Their primary focus is to review the needs of every child across our system, to remove barriers and challenges, to ensure that children and families receive the care that they need. While we're used to managing short-term surges in volume, whether it's related to a mass casualty event or COVID or whatever it is, the state that we are in is not sustainable. This is a situation, like David mentioned, unlike any other that we've experienced, most of us in our career. Some of us have been in healthcare for more than 35 years. So it's unlike anything that we've experienced before. I just want to reiterate that mental health is a part of overall health. It's not separate. It's part of the total health of children, adults, and our community. And it's a community issue. So we're looking forward to partnering to work on everything from prevention to managing the most complex behavioral health care needs of the children and families we serve, just as we do our physical health needs of those we serve. Thank you so much for your time today. And I have the privilege, I believe, of passing this off to Heidi, help me.
Our County Commissioner, Tamara Pogue.
There we go. Thank you.
Thank you all. I very much appreciate the opportunity to be here today. I think it is somewhat unusual for county government to have begun to play such a large part in the delivery of youth behavioral health care. But increasingly across the state, you see many counties, not just mine, stepping up to fill that role. Behavioral health care for our tiniest residents, for our littlest humans, has in fact become a crisis. Everywhere I look in Summit County, I see signs of this epidemic. Our SMART team, our co-responder model, has seen a doubling in the number of youth that they have, in crisis that they have to respond to between 2020 and 2021. Our Department of Human Services says that 100% of the families that were screened in a case of child abuse and neglect last year had an underlying behavioral health issue that needed to be treated. In our school-based health program, we have funding to hire more providers. And in fact, we need 3 more to meet the demands and the wait lists, but we can't find those providers to provide that care. And in Summit County, we provide and pay for therapy for any resident that can't pay for it some other way. And as of April of 2021, we had already issued more vouchers for treatment for children than we had in all of 2020. The crisis continues to grow. And as county government alone, we simply cannot keep up with the need. Summit County is more fortunate than most counties in that we do have a local property tax initiative fund behavioral health care. That fund generates $2 million every year, and yet that is merely a drop in the bucket compared to what we need for the entire safety net of behavioral health care, let alone behavioral health care for our children. In a small rural community like mine, youth suicide doesn't often end up in the newspaper, but we all know that it happens. We all know the tragedy, we all know the stories. I will never forget learning about our first 11-year-old girl who took her own life in 2017, the spring of 2017. In the spring of 2020, just 2 weeks after our schools went completely online, we lost 2 more children to suicide. These deaths are tragedies, but for me, an equal tragedy, perhaps an entirely different tragedy, is that we are not spending the financial resources we need to spend on building a safety net, on building a system of care that can actually address this epidemic. Who knows if any of those suicides could have been prevented? None of us ever will. But I do know that unless we make even deeper and more significant investments in this system of care, in our safety net, we will continue to lose more children. That is something that I simply cannot tolerate for my community or any community in Colorado. I beg for all partners to come to the table to make deeper investments in creating a safety net, in creating the deep level of care that we would treat any other illness with. We are desperate in communities across Colorado, and we are desperate for help and partnership and collaboration.
Thank you, Commissioner Pogue. And with that, I'd like to give the floor to Executive Director of our Colorado Rural School Alliance, Michelle Murphy.
Thank you so much. It really is an honor and a privilege to be a part of this panel. And I tend to get a little weepy and passionate when I talk about these issues too, because I think many of you may or may not know that 146 of the 178 school districts in Colorado are rural. The vast majority of those schools have really kind of worked incredibly hard to keep their students in school all year. That doesn't mean by any stretch of the imagination that they aren't facing extreme stress, both the students and their families, due to loss of jobs, the isolation that comes with the pandemic, even if they're in school. And as with other areas, including broadband and teacher shortage, the pandemic has really shown a spotlight on what has been an issue in our rural communities, as you just heard in Summit, which is one of our bigger rural communities and sort of one of our wealthier rural communities. But issues around educator shortage and counselor shortages and what we call special service providers, psychologists, healthcare have been, I would say, at crisis levels in rural Colorado for years. And so we're glad for the opportunities created by the pandemic. We're glad for the partnerships that have been created locally with local health officials and mental health officials, that we all can leverage dollars we hope to see from the state and the federal government to really build programs to increase resiliency within our kids, and I would say our teachers and families as well. Teachers, absolutely, educators need training to understand and identify mental health concerns so that they can then refer students out to appropriate resources in the community. School-based supports are fantastic, but I don't want us to create this idea that teachers should be the frontline mental health providers for our students and staff. We really need partnerships in our counties and dollars going to our counties to increase the workforce. We have heard some optimistically, there are some rural communities looking at, I think, innovative workforce development programs. Let's get rural kids excited about jobs in rural schools, in rural communities, including mental health positions. Inpatient facilities are almost non-existent in rural communities. Day treatment facilities, almost non-existent in rural communities. Our higher needs kids have no place to go, and it's devastating. And we need to do better. We can do better. It looks like we'll have some fiscal resources to do better. So I'll stop talking there, and thank you all again for bringing critical attention to this important issue.
Thank you, Michelle. And now we'll hand it over to Dr. Mike destefano, Chief Medical Officer for Children's Hospital, Colorado Springs.
Thank you, Heidi. I'm an emergency medicine physician, so I hold this topic pretty near and dear to me. In 2019, we had the opportunity to open a hospital here in Southern Colorado, in Colorado Springs. whenever you open a facility, you get to do some programming. And one of the programming that we had the opportunity to do is put in a psychiatric emergency department within our ER. This is sort of novel for children's emergency departments. You don't see this around the nation. When we scoped it, we scoped 25% of our beds to be dedicated to behavioral health. And at the time in 2018, 2019, I thought that was a very generous amount of beds. Today in 2021, the reality of it is that 50% of our patients in our emergency department are behavioral health, and we've outstripped our capacity here locally. There are many nights that we are dealing with more behavioral health issues than medical issues in our emergency departments. It has been a large problem that I think as we look at solutions, we can't depend on building beds to get us out of it. If we are building beds, acute beds, we're losing the battle against suicide and behavioral health problems with our teens. We need to be intervening prior to the crisis. We need to be giving resources to kids so that they never reach that crisis point. We need an integrated youth mental health system to address this problem. And if we do not address the problem that way, we are going to continue to have these issues that arise in our own families and our friends' families and our neighbors' families. And approximately a couple of years ago, our transfer team, so we have a dedicated children's transport team, would see 3 to 4 cases a year that we were transporting youth, whether it was behavioral health crises or suicide attempts into our system. We're now seeing 3 to 4 a week. This is not a sustainable model for our kids. It's not a sustainable model for our future. And I would be remiss if I didn't mention sort of our rural partners. I feel as we opened our beds here in Southern Colorado, we are sort of a spoke to our rural partners. And, you know, while we do not have the resources here locally in some of our more populated areas, you heard today that it's even more challenging in those rural areas. And so we have to address those issues as well, because what we feel here locally in sort of the Front Range is drastically different in some of our rural communities, and they are being overwhelmed. So my ask is, let's look at prevention. Let's look at outpatient resources. Let's talk about acute care as a part of the solution, but we have to be intervening prior to those crises really escalating and elevating to the need of a acute management of youth suicide. So with that, I'm going to pass it on to Heidi Baskfield.
Thanks, Dr. DeStefano, and thanks to all of our panelists. Just to wrap things up before we get into the question and answer period of our program today, I want to talk about a few things. One, I want to remind our participants that Colorado currently ranks 42nd in the country with respect to being able to serve our existing mental health youth needs. I also want to remind our participants that in the last several years, we've seen 47 facilities close that had traditionally provided mental health care to kids in our state. So at a time when we are seeing volumes increase, severity increase, and overall need, the system that is meant to be in place to serve these kids does not only not exist, but those who are attempting to do this work are currently underwater, overwhelmed, and as Jenna would say, in a state of emergency that requires higher level needs of support. We are asking for the kind of support where we have the state engage with us as partners in treating this crisis in the way that it can, bringing the resources it has to bear to support all of us working in this space. Using tools like executive orders and public health orders to empower those to work together to do things like create patient transfer centers to manage current need and capacity, and to think about solutions like tapping into our American Rescue Plan Act dollars to think how we can expedite the creation and operation of a comprehensive system of mental health care for kids in the state of Colorado that we don't currently have. The federal funds that are flowing to the state of Colorado under the ARPA are meant to inform and support the build of community infrastructure. There is no greater infrastructure need in the state right now as it pertains to youth than that with respect to mental health So we are seeking partnership from our state and federal partners in engaging this important work. Now, as we kick into the question and answer period, I would just remind folks to please put their questions in the chat. We'll make sure that each of our panelists has an opportunity to respond appropriately. And I would also let you know that along with the panelists I introduced earlier for purposes of our Q&A, we also have Dr. Jenna Glover, a clinician who is part of our Pediatric Mental Health Institute, who brings a wealth of knowledge into this space, who can also answer questions as well. Okay, our first question. What are some solutions that other states are using to address these concerns? And can Colorado model some of these fixes based on these ideas? I'm going to first start with Commissioner Pogue to talk about things that she has seen in other states that may be useful to apply here. Commissioner Pogue.
I actually don't think it's as much a question of innovation from other states as it is, to Heidi's point, where Colorado sits in terms of per person funding for behavioral health. If you compare where we sit, I think Heidi said we were 48th in the country. And so that means that we simply do not have the dollars available to build out the infrastructure necessary to create a safety net or a high quality level of care. That begins with, to Dr. Stefano's point, with prevention. Helping our kiddos learn resiliency skills, learn the coping mechanisms that they will need to serve them throughout their life. It transitions into providing therapy and specialty care for eating disorders or substance abuse. And then it looks like an intensive outpatient system for those kids that reach the next level of care, but whom we are trying to keep in our communities. Because once we have to send them out of our communities to be hospitalized, it's even harder to help them cope when they return. And then obviously it creates a last level crisis intervention system. In our community, that's our co-responder program, but there are certainly other models for that. The bottom line is we know what works, we simply can't afford it in Colorado. And that, I think, is the challenge.
Thank you, Commissioner Pogue. Dr. Brumbaugh, can you speak a little bit more to the 90% number and what that actually looks like and means, please?
Sure. So I think from what we're seeing on a day-to-day basis, these are patients presenting acutely either to emergency departments or requests from transfers from outside hospitals for what is largely acute suicide attempts. So patients that are acutely suicidal that need an inpatient behavioral health resource. Now, that's, I think, as Dr. destefano said, the tip of a much larger problem. If you speak to our primary care referring providers in the community over the last 12 months, this is what they're seeing every day. Perhaps not acutely suicidal patients, but a much larger proportion of their patients are seeing in clinic with mental health problems, depression, anxiety being, I think, foremost among those. So we're seeing this impact on all levels of our system, but the 90% is patients that we're either transferring in or presenting to emergency departments.
Thanks, Dr. Brumbaugh. Dr. Glover, this question is for you. Why do you think things are getting worse right now? What are you seeing? What do you think is contributing to our current crisis?
Yeah, so despite things getting better in terms of COVID, kids have dealt with chronic stress for the past year that has interrupted their development in education, their social development. And so this stress on top of these delays, now kids are asked to be starting back into life again. And many of them feel behind and completely unprepared to be able to go back to regular functioning, which is making them feel completely overwhelmed. During COVID, a lot of my patients talked about at least their teachers are having grace and understanding that things are difficult right now. Many of them feel now they have to just re-engage in life, and they don't have the resources to do that. They're burnt out and they feel so behind, they don't know how to catch up. So there's a sense of hopelessness. And we know that hopelessness is the number one predictor of suicidal ideation and suicide attempts. So that's probably why we're seeing this crisis emerge in this way, despite things getting better with COVID.
Thank you, Dr. Glover. Commissioner Pogue, how many vouchers for children have you given out this year so far?
As of the end of April, we were paying for therapy for 87 children in Summit County.
Thank you. And with respect to the county perspective, and then I'm going to come to you next, Michelle, how would you use stimulus funds to create improvements in creating and operating a system of care for youth mental health. So you first, Commissioner Pogue, and then you next, Michelle.
We have a number of priorities for expanded treatment in Summit County. I would say the highest priority for us at the moment is an acute treatment unit that has beds for youth. We also want to continue to grow our peer support programs for our youth, and continuing making sure that we have the funds to pay providers what they need to choose Summit County as their home so that they can provide the needed care in our community.
Thank you, Commissioner. Michelle, what about you? How would you use
Yeah.
stimulus funds from your perspective?
Well, it's my members who will use the funds, and I just got off the call with a team from one of our counties in the Northeast, and they're really looking at what I would call a group hug for these kids, right? Where there's mental health counselors and behavioral health counselors placed in the school by the county, so they're a partner to the school. They're training the teachers and the staff on how to identify and understand where kids are at and what their symptoms may be presenting, right? We're having social workers doing professional development for teachers beyond the instructional piece, and then ensuring that the people in the schools are aware of the resources in the county. It's a model that has worked. I live in Boulder County, and we have a similar model when we identify kids that are at risk. So there's no shortage down in San Juan area. They have partnerships with their Department of Human Services where they're using the DHS funding to get caseworkers into or mental health workers into the schools. So with the appropriate level of resources, there's no shortage of what they can do and plan to do.
Thanks, Michelle. Also from the Children's Hospital perspective, I think one of the things that we would add to this picture that is being painted here between the commissioner and Michelle Murphy is this need of the comprehensive approach to this. And so it is not only how do we ensure that we have enough bed capacity, how do we ensure that we have enough providers in the state of Colorado, how do we make sure that we have enough by way of supporting moments of crisis, and then successfully transitioning kids throughout the appropriate levels of care. So whether that's hospital, step-down facilities, outpatient, primary care, and of course, those critical services that allow kids to remain at home with their families appropriately served and supported. The number of children that we continue to send out of state with severe mental health should alarm everyone. It is more expensive to do this, and it is tearing families apart. So when we think about huge needs, we would contribute that perspective to this conversation. The next question goes to Pat Gibbons, Chief Nursing Officer. Pat, can you talk more about the existing number of beds and what the future plans are for Children's Hospital in this space?
Yeah, I'll walk through this for you, be glad to. So in our inpatient acute care area, we will be going from 18 to 26 beds as of March 2022, roughly that period of time. Our neuropsychiatric special care unit will be going from 4 beds to 6 beds around the same time. And as you probably are aware, a lot of our services are outpatient or a mixture, what we call partial hospitalization. So our eating disorders program will go from 12 to 20 this summer in 2021. Our partial hospitalization program will go from 16 to 30 again this summer. And our neuropsychiatric special care inpatient unit will go from 5 to 12. This is the day treatment program. So you can see we're trying to increase all of our services, and as some of these physical spaces come on board, we are onboarding them. And as we mentioned before, we are looking at a 10-bed med psych area in our inpatient medical area. So
thank you, Pat.
That question.
Dr. destefano, a question for you. With respect to the crisis in the El Paso and Colorado Springs community, what are you seeing are some of the biggest challenges in what's causing so many kids to be stuck in the Colorado Springs system and not able to be served in other places outside of the hospital?
So I'll break this question up into 2 parts. I think, there is a lack of resources and identification of kids who are in crisis. So I think when kids are sort of escalating and bubbling up, they tend to not get what they need to sort of address the issues at hand. And so they present acutely to our emergency department. Once they're in our emergency department, I sort of think of this as we triage them to, do they need inpatient therapy or not inpatient therapy? And if you need inpatient therapy, there is a lot of limitations for the pediatric population. So once you get into the teenagers, age range, it opens up different care facilities to take care of patients. So if you are less than 13 or 13, you are going to struggle finding placement, and subsequently patients tend to sit in our emergency department for an extended amount of time waiting for available beds to open up, because those are what I would say are our most precious resources within pediatric mental health, is really the beds that are dedicated to those pediatric age ranges. So it can be an extreme challenge to move patients to the next step of treatment because there's just lack of access.
Thank you, Dr. DeStefano. Another question that has come up is, how do we see the state behavioral health task force blueprint impacting the ask that we're making today? And I can take that one, and others may jump in as well. What I would say to you is that that is an incredible document that was developed by critical stakeholders throughout the state of Colorado, identifying what were the critical needs that we needed here in the state of Colorado, but didn't currently possess in any kind of systemic fashion that needed to be built and operated now going forward. I think what you're hearing from all of the panelists today, and we are but a tip of the iceberg, is that the pace at which we are moving to create those components to advance the work of the blueprint is not moving fast enough. And we are losing ground because of how many are getting out of this business and unable to be able to provide the supports and services that are desperately needed. So what you're hearing from us is that the blueprint is an effective plan, and its implementation needs to be expedited using creative solutions and incoming resources flowing from the federal government. Okay, Michelle, we've got a question for you. If there was an influx of money to hire mental health professionals in schools and other settings, do we have enough qualified candidates to fill those positions?
No, we don't currently. We've seen a lot of advances during the pandemic using telehealth opportunities. We've actually expanded the last couple of years at the legislature grant money for counselors to allow us to use those grant dollars for telehealth and community providers. I do think that I know that there are some incredible and innovative programs out there around developing and increasing the workforce and using student interns and getting them out into rural programs. But increasing access and increasing the workforce would be, in my mind, one of the priority placements for that, for those dollars.
Thanks, Michelle. Commissioner Pogue, you also made mention of this when you were sharing earlier. How else would you add on to what Michelle's sharing?
I mean, workforce shortages are one of the greatest challenges we face, not just for master's level clinicians, but an ability for our youth to access medication, for example. So many of our primary care physicians are prescribing medication to kiddos with not the level of training that they deserve to have that responsibility or requirement on their practices. And so certainly at every level of care, we see workforce shortages that create challenges in helping our kids access the system of care that they deserve.
Thank you, Commissioner Pogue. First, I'm going to go to Dr. DeStefano, and then I'm going to go to Dr. Brumbaugh next. Mike, can you speak more to how many beds we have dedicated to behavioral health currently in the ED in Colorado Springs, and how that factors into the number of half of our beds being used to serve kids with mental health needs?
So we have 6 dedicated beds out of 24 beds in our emergency department right now that are dedicated to behavioral health. And what that is a 6-bed unit that is locked. We accommodate those beds to ensure that they are safe for that patient population. When we end up caring for more patients than what can accommodate in that unit, we have other rooms in our emergency department that we can strip and make safe for those patients. And so at times, so we have a 24-bed unit, so it's not unheard of to have 12 to 13 behavioral health patients in our unit, either waiting to get for an admission or waiting to get evaluated to triage whether they need acute admission versus outpatient therapy. So while we only have 6 beds that are locked, we can accommodate a larger number with our emergency department.
Thanks, Mike. Dr. Brumbaugh, can you answer the same question as it pertains to other emergency department spaces in our system?
Sure. In terms of the total number of beds, sure. We're able to take care of up to 40, patients at our emergency department at our Anschutz campus. And what we're seeing is we have a certain small number of beds that are more appropriate and designed for behavioral health patients. But because our number and our influx has been so high, those behavioral health patients are spilling over into medical beds, which puts stress on the operations of our emergency department and certainly requires less efficient staffing models for us that put stress on our system as well. At our North Campus and South Campus locations, those are really, medical emergency departments without sophisticated, dedicated emergency behavioral health emergency beds. So, oftentimes we're in situations where we have to shuffle patients around our system to keep them safe. So, we certainly have been in a spot, Heidi, in the last few weeks where the number of behavioral health patients that are waiting for beds has impacted the overall operations of our emergency system.
Thank you so much for that. Another question that we've received, and I'm going to start with Commissioner Pogue, is around what we see as the obstacles to really getting the kind of funding support that is needed to be able to create and operate a youth mental health system of care. So Commissioner Pogue, I'm going to have you start, and then I may jump in once you're finished there.
So I certainly was heartened by the announcement yesterday of the state's priorities around their stimulus funding. I think the $400 to $550 million that's being proposed is much needed. That said, that is obviously one-time, primarily infrastructure funding. And while we certainly need that funding, there is also a great need for funding for long-term programming support. I think, I would also point to the work of the Behavioral Health Authority and my optimism for that process. Not only is this a conversation about funding, this is also a conversation about the system of care that needs to be developed in Colorado and making sure that the funds that accompany that system are transparent, are being well used to make sure that we are creating the best outcomes for our youth in Colorado. And so I would point to both of those as really important strategies moving forward.
Thank you. And I don't know that I would offer much more than that, but would ask sort of a second question to that, Commissioner Pogue, and that is if you could ask Governor Polis for anything specifically to help right now, what would that ask be? And I won't make you be the only one that answers that question.
Well, I'd say for 15 years, first as a director of a human service agency and now as a commissioner, I've been asking for a roadmap of what should a rural community have to provide the very highest system of behavioral health care. And no one has been able to produce that for me as many times as I have asked. So I would like to know from the experts, what are the things that my community has a right to have to make sure that we are doing everything possible to avoid the tragic outcomes that I've mentioned? I mean, the list is fairly endless. It is certainly prevention. It is certainly peer support. It is absolutely more therapy. It is creating less stigma around this entire conversation. It's intensive outpatient. It is substance abuse treatment and eating disorder treatment. The list is incredibly long. And so I would say anything we can do right now will certainly help improve where we find ourselves currently. But there is a great deal of work that needs to be done in this space.
Thank you, Commissioner Pogue. I would say that in addition to that, I think Children's Hospital would ask that the governor and his team use the powers of the public health order and the executive order to empower very critical partners to come together to begin working on immediate fixes to the crisis that we're seeing And this would include doing things like creating a patient transfer center, similar to what we did to manage the care of COVID positive patients, to be able to support the adequate movement and the capacity, the very limited capacity that providers currently have to appropriately serve these kids. Michelle, I'm going to punt this question to you as well. If you were able to ask for support right now from the governor and that team, what would you be requesting?
Well, I think like Commissioner Pogue, we are interested. We did have a roadmap for schools that Mental Health Colorado put in together. We think issues are around capacity. I think recognition. We need funding support. We need local bodies that are able to build and grow these programs over time and sustain them. And we need recognition that one size does not fit all. Get the money out to our counties, get them some resources and best practices, and let them go to work. They'll get it done, but they need the resources and they need the flexibility.
Thank you, Michelle. Jenna Hausman, this question is for you. What is your fear of what is to come if nothing is done to address the current crisis?
I think quite simply, we would lose more children. And I think that's the unacceptable call to action, is that we know what's happening. The increases are occurring at a pace that is unprecedented. And so this is about truly how we come together as a state and bring the expertise we have, the passion we have, the commitment we have to really work together at a much higher level of urgency with higher level of resources to unleash that passion that occurs in our counties, in our schools across the state. There are highly committed partners ready to do this work if we can focus on it and truly free up some of the bureaucracy and enable really incredible, passionate experts to hold hands and to wrap them around our children. There is no lack of energy and commitment to get this done. It really is about prioritization, flexibility, and resources. And I know we can do it.
Thank you, Jenna. Dr. Glover, question to you similarly. What are you fearful of based on what you are seeing if action isn't taken? And can you please elaborate more on how kids are coping with added stress? How does that show up? And are you seeing higher levels of self-medicating, drug, alcohol, tobacco, vape use? And what should parents be doing in this space?
I think my largest concern is with the influx of mental health problems that we're seeing and the demand on the system. Kids will not get the treatment they need, and they will have chronic mental health problems for years that will impact their opportunities in life. So that's my number one concern. I think most problematic, what is happening is that kids are coping primarily through substance use, through withdrawing, and through disordered eating behaviors. So we're seeing higher rates of substance use diagnosed. We're seeing higher rates of eating disorders diagnosed. And those are primarily secondary disorders when you're going through crisis. And kids are using those in a way to escape feelings or try to gain a sense of control. One thing that stands out to me most that I think parents should be aware of is that kids are more likely to say that they would rather not talk to somebody about all that they're feeling because of concerns of how it will stress other people out than use substances. And this is the first time we've ever seen that trend. When kids are really stressed, they're more likely to say, hey, I want to use substances. So it's so important for adults and for parents to be checking in on kids' mental health. This is not a one-time thing. This is something that needs to be done on at least a monthly basis, because it's going to change over time and it's not going to go away over the next year. And so those are my main concerns, and especially how kids are coping and those increases in eating disorders and substance use, because we're not primarily treating things like depression, anxiety, and trauma.
Thank you, Dr. Glover. Really well said. Another question came up around what are the kinds of bureaucratic processes that we may want or benefit from having more flexibility around to better serve kids in this space. And I can tell you that in the same way that the state was so effective in being thoughtful about waiving certain requirements to allow different systems to better serve patients experiencing COVID, there are similar opportunities to be had in the way that we serve kids with mental health issues. So working with providers differently to think about where and how to best serve these kids based on what they need is where we need thoughtful conversation taking place right now to allow and afford for the same flexibility in this space that has been provided in how we've created care opportunities for COVID patients. Commissioner Pogue, anything you can think of in that space that occurs to you you'd like to share?
Yeah, I would really stress more flexibility in funding for counties. Traditionally, the funding mechanisms for behavioral health care in Colorado have sort of run out of the Medicaid space and largely are dependent on community health centers to provide care in rural communities. And I think we need to broaden that model to allow counties to really recruit more provider partners and different types of provider partners depending on the needs of an actual community and what the community's data says is needed.
Thank you, Commissioner. Another question too around what is Children's Hospital specifically doing to think about the provision of care outside of the Front Range and into our rural areas? And one of the things that I can tell you is that one of the huge success stories of the pandemic has been our ability to quickly engage in the provision of care through a telemedicine platform. So our ability to partner with pediatricians and family medicine doctors in their communities to support kids in their communities, to keep them as close to home as possible in meeting those needs, continuing to build up sort of that robust offering of the medical home, partnering differently with school-based health centers. These are the kinds of partnerships that were such a strong outcome of the pandemic that will continue going forward. Jenna Hausman, anything you would want to add to that?
I think the telehealth, we've been very fortunate as a silver lining of this COVID pandemic to really accelerate how we utilize digital and telehealth services. And I think this is a really incredible opportunity to not go backwards to pre-pandemic levels where you had to physically go somewhere to receive care. We do see a high receptivity to mental health services, having a high compliance rate and a high effectiveness rate in the telehealth capacity. So I think how we continue to leverage technology across the state through different partners is going to be a consistent part of our future and one solution that we'll continue to leverage.